So, as some of you know, I lost my father to COVID a few months ago, and also my wife, my girlfriend, she lost her father a month or so later, and also our kids, who Sophie and Georgia are from Irena's first marriage, and they also lost their grandfather to COVID as well, within the same couple of months. And besides that, I also know a few people who as well lost their fathers to COVID. So what happened is always that they all had some degenerative disease, Alzheimer's, blood clots, cardiovascular, and diabetes or early diabetes or something like that. So there was always some degenerative disease, which is, I guess, normal when you are 78 years old. They were all kind of that age, 75 plus, 70 plus actually. But I mean, these degenerative diseases are typical for that age. I mean, most of the people have them. It's very hard not to have them at 70 plus. So what most people don't understand about corona is that, because I met a lot of people say, well, I'm young, I went through it, it's fine, or it's not so scary. Well, if corona remains, if it's not eradicated, if we don't destroy it, then most likely all of us will suffer from it, and we will lose 5 to 10 years of life when we get to that age. Because already now I have, for example, high blood pressure. That's just how I am, how my body is, and I had it for a long time. So meaning I already have degeneration. I have degenerative disease, and most people have it, are gonna have it later. And if the corona is still around, I mean, that's gonna cut 5 or some years or maybe more, considering also how medicine is advancing, that we're gonna lose 10 or more years of our lives. And because corona is really, really, really very predatory towards older people, and especially men. And so this is extremely dangerous. And if it stays around, if we treat it like it's a like whatever, it can stay forever. It's gonna continue crippling the old people, constantly. And I don't think many people realize that. So we are not fighting that disease to be, to not have it today. We are fighting to help the older, the weaker, and also ourselves when we become weaker and older. Because if it's not eradicated in this year, in 5 years, in 10 years, I'm 44. So if in 30 years, it will kill me, and because it is extremely predatory, extremely aggressive. I mean, my father and all these fathers that I know, I mean, it was always the same thing. They get it for 5 days, seem okay, then it attacks the lungs really aggressively, and then it's a matter of a week, and it's always the same thing happens, and it's very, very fast, and there is no turning back. I mean, I heard stories of turning back, but around me, what I've seen, there is no turning back. It's very fast. Since you get it, you have 2 weeks to live, and so with older men, women, my mom was fine, almost no symptoms. My kid had it, my Irena had it. So obviously for younger and for me it's fine, but if we don't fight it, we have to understand that certain demographic, which is 70 plus men, who usually have, and almost commonly have degenerative diseases, are at unbelievably high risk, and if we don't beat it, it's going to stay around, and when we reach that age, we're going to be hurt by it. We're going to lose years of our lives, and this doesn't make sense. If we can do it scientifically, we should really try to help ourselves in the future, or try to help everybody in between, everybody who's going to reach that vulnerable age of 70 plus. So I don't know, just think about it.